There are in fact 5 types of pain considered to be the most extreme: trigeminal neuralgia, cancer pain, shingles, kidney stones, and then there's a gout attack, which feels like 10,000 ants gnawing at your bones. It's like being slowly tortured, making it nearly impossible to even take a single step. Hong Kong's richest man, Li Ka-shing, the famous movie star Eric Tsang, Guo Qilin, the son of Guo Dagang, Jackie Hung, the son of Tiffany Chen, even my own bunkmate from my college days. None of them could escape the clutches of gout. According to the 2021 White Paper on the trends of high uric acid and gout in China, the number of people in our country with gout is approximately 15 million. That might not sound like a lot, but the number of people with hyperuricemia is close to 180 million. The main difference between the two is this: if you've experienced the pain, it's called gout. If you haven't yet, it's called high uric acid. What's even more shocking is that a paper that sampled from 5 districts in Guangzhou with a total of 1,612 students revealed that among high school students in urban Guangzhou, more than half of them tested positive for high uric acid. This condition, which in the traditional view was an ailment only the elderly would get, is now spreading at an unimaginable speed among the younger population. If you often sit for long periods, stay up late, are constantly tired and indulge in rich food and drink, and your kidneys aren't in the best shape, especially if you're a man, then you really need to start paying attention. Because aside from triggering gout, high uric acid is also closely linked to hypertension, diabetes, abnormal blood lipids, and cardiovascular diseases. It can even damage kidney function, and if left unmanaged long-term, it can even shorten your lifespan. So we have to ask, who are the high-risk groups for gout? What is the connection between high uric acid and gout? What factors raise uric acid levels and trigger gout? And how should we prevent, treat, and manage it? And how should we prevent, treat, and manage it? And how should we prevent, treat, and manage it? To get to the bottom of this, why don't you go ahead and type your uric acid level in the comments right now? By the time you finish this video, those numbers can all return to normal. And may we all be spared from the slow slicing torture of gout. Gout often occurs in the joints of the extremities. The most common site is the big toe. It causes excruciating pain that strikes as swiftly as the wind, hence its name. I made that last part up. But the dictionary does have an entry for gout. The definition reads, a pain in the bones and joints of the limbs caused by pathogenic wind. The Yuan dynasty physician Zhu Dangxi referred to gout as the white tiger joint traversing wind in his Gezhi Yulun, meaning it was as unbearable as being bitten by a tiger. Throughout history, it has been called the disease of kings and the illness of the wealthy. Its sufferers were often kings, nobles, and high-ranking officials. For a very long time, gout was even considered a symbol of wealth and status. Many famous figures in history were graced by its presence. For example, Li Bai Newton da Vinci, Goethe, Darwin, Bai Juyi, Kublai Khan, Maupassant, and Galileo. So why do people get gout? Galen of ancient Rome believed that gout was caused by an accumulation of heredity, bodily humors, and debauchery in the joints. However, he emphasized that dietary moderation, abstinence from alcohol, and celibacy were the 3 key factors in preventing gout attacks. Then in the year 1200, a monk named Randolphus further refined the humoral theory. He believed that gout was caused by morbid substances in the blood, dripping into and around the joints. Even from a modern perspective, this diagnosis is astonishing. While not entirely correct, it wasn't far from the truth. Of course, the celibacy part has now been pretty much ruled out, so for those of you with needs, you don't have to worry too much. The true culprit behind gout, it wasn't until 1848 that a British doctor, Alfred Baring Garrett, uncovered the truth. After measuring the uric acid levels in blood, serum, and urine, he discovered that most gout patients had high levels of uric acid, and the inflamed areas were always accompanied by uric acid deposits. So he boldly hypothesized that the deposition of urate salts was the direct cause of gouty inflammation. However, this only proved a correlation between high uric acid and gout. It couldn't establish causation. It's like how a murderer will be at the crime scene, but that doesn't mean everyone at the crime scene is a murderer. To prove the causal link between high uric acid and gout, a hardcore badass named McCarty brutally injected his own knee with a tube full of urate crystals, and while he was at it, he gave his assistant a dose, not forgetting to inject his other knee with a crystal-free saline solution as a control. A few hours later, the knee injected with the crystals erupted with a pain similar to a gout attack. In agony but ecstatic, McCarty then gave a dog a shot, and the dog showed a similar effect. At last, the relationship between gout and uric acid was finally as clear as day, laid bare for all to see. Every solute has a certain solubility in a solution, and uric acid is no exception. When the concentration of uric acid in the blood exceeds this limit, the supersaturated uric acid may precipitate out, forming sharp, needle-like uric acid crystals that accumulate in joints and kidneys. Interestingly, your pain and inflammation aren't caused by the physical damage from these crystals. Instead, you have the diligent do-gooders inside your body to thank. Your pain and inflammation aren't caused by the physical damage from the crystals. Instead, you have the diligent do-gooders inside your body to thank. The diligent do-gooders. The immune system, one day on a whim, decides it wants to help you clear out these crystals, so it casually kicks off a local immune response. And so an intense inflammatory reaction complete with redness, swelling heat and pain rapidly sweeps through the site of the deposits. To be honest, its heart was in the right place, but after all the commotion, you're left in excruciating pain. About half of all gout cases will affect the big toe. For those of you who have won a Nobel Prize in physics, you should already know that solubility is related to temperature. The big toe is furthest from the body's core and has the lowest temperature, so the probability of an attack increases dramatically. Other joints, such as the ankles, knees, wrists, and fingers, can also be affected. The joint pain often starts at night or in the early morning, which may also be due to the lower body temperature at night. During a flare-up, the pain gradually intensifies and reaches its peak within a day. The affected area will often turn red and become extremely painful. Some patients might even develop a fever after the pain subsides. Some joint discomfort may persist for a few days to several weeks. However, this isn't the end. It's the beginning of your journey with gout. So what level of uric acid is considered too high? From a pathophysiological standpoint, when the body's temperature is 37 degrees Celsius, the saturation concentration of uric acid in most people's blood is 420 micromoles per liter. That's why in China's multidisciplinary expert consensus on the diagnosis and treatment of hyperuricemia-related diseases, hyperuricemia is defined as, for both men and women on a normal purine diet, having your fasting blood uric acid level on 2 separate days. Fasting blood uric acid level exceed 420 micromoles per liter, because estrogen has the function of promoting uric acid excretion. Before menopause, women have a fairly long period of protection from gout. According to the 2018 China Chronic Disease and Risk Factor Surveillance data, the prevalence of hyperuricemia in adult women was 3.6%, while for adult men it was 24.4%. For young men between the ages of 18 to 29, the prevalence rate is as high as 32.5%, showing a significant trend toward younger ages. No wonder the International Gout Risk Assessment chart considers being male a point-adding factor. You guys can also use the chart to calculate your own score. Less than 4 points is low risk. 4 to 8 points is medium risk. If your score is 8 or higher, then you and gout are just one fateful encounter away. But to be clear, gout is closely related to hyperuricemia, but that doesn't mean hyperuricemia will definitely lead to gout. Clinically, only about 5 to 15% of patients with hyperuricemia will develop gout, and that's why some of you might have uric acid levels that are off the charts, but haven't been hit with an attack yet. But this is nothing to celebrate, because besides gout, hyperuricemia brings on other kinds of damage. For example, not only is it an independent risk factor for cardiovascular disease, it also interacts with metabolic abnormalities like obesity, high blood pressure, high blood sugar, and high cholesterol. They all influence each other. Moreover, for women with hyperuricemia, the risk of developing coronary heart disease is even higher than for men. It seems every gift bestowed by fate has already in the shadows had a price tag attached. For every 60 micromole per liter increase in blood uric acid, the cardiovascular disease mortality rate for women increases by 26%, and the mortality rate from ischemic heart disease increases by 30%. For men, those numbers increase by 9% and 17% respectively. When urate crystals build up in the kidneys, it can lead to chronic urate nephropathy. Early symptoms include urinating more frequently at night, and you might gradually notice foamy urine. In later stages, it can lead to kidney failure. High uric acid levels can also cause kidney stones. When these stones block the urinary tract, it can cause excruciating pain, known as renal colic, blood in the urine, and difficulty urinating. Therefore, even if you're not having a gout flare-up, we can't ignore the problems caused by high uric acid. So that begs the question, this uric acid in our bodies, where does it come from, and what factors influence it? Contrary to what most people think, the uric acid from the food you eat only accounts for about 20% of the total. The remaining 80% or so of uric acid is actually produced by our own bodies. Let's start with a quick high school biology review. Purinas are an essential component of DNA. When cells in our body get old and die, the DNA inside them is broken down and metabolized. The purines from that DNA are then converted into uric acid, which is then flushed out of the body through the kidneys and digestive tract. Under these circumstances, uric acid levels are usually normal. So what can affect these uric acid levels? First, poor kidney function. About 90% of patients with persistently high uric acid levels have some defect in how their kidneys handle uric acid, and this is often linked to genetics and gene mutations. When less uric acid is excreted, the levels naturally go up. Second, dietary intake. Now, most people probably already know this. Organ meats, seafood, and rich broths. All foods rich in purines can raise your uric acid levels. But in fact, the effect of alcohol and fructose can be even more significant. First off, alcohol metabolism increases the breakdown of ATP, which promotes the formation of uric acid. Secondly, the lactic acid produced when your body metabolizes alcohol competes with uric acid for the same excretion pathways, which in turn reduces how much uric acid gets flushed out. So what about drinking low-alcohol beverages? Nope. That's because some alcoholic drinks, for instance, beer itself is very high in purines. So what if you skip the alcohol and sit at the kids' table? Can you drink juice? Well, what a coincidence. Fructose and uric acid happen to use the very same excretion pathway, and the fructose content in juice is way higher than in whole fruit. All right then, I'll just have some snacks that should be fine, right? The high fructose corn syrup added to processed foods and drinks is the real fructose assassin. That's the real fructose killer. Besides limiting your dietary intake, you also have to be extra careful about getting enough rest. For example, staying up all night and overworking prevents your body and cells from getting adequate rest, causing the body's metabolic byproducts to accumulate and altering its internal environment, which in turn causes uric acid levels to rise. In addition, medications like aspirin and diuretics, metabolic diseases like the 3 highs, and habits like not drinking enough water can all disrupt your normal uric acid balance. Just one of these factors is enough to raise your uric acid. So what would happen if you had all of them? The answer is you'd become Guangdong province. Across the vast land of China, very few provinces manage to stack as many buffs as Guangdong. They've got not only raw marinated seafood, fresh seafood and sashimi, but also beef hot pot and boiling pork offal, and their famous slow-cooked soups, which manage to keep the dregs and toss the essence. And although the people of Guangdong, who love their sweet dessert soups, have the lowest alcohol tolerance in the country, Their alcohol consumption is among the highest. The key is people in Guangdong are also extremely rich, with jingling keychains and incredibly strong purchasing power. Add to that the southeastern coastal regions, widespread gout gene, and so is in a league of its own when it comes to high uric acid.